Hello, I'm Dr. David Green, CEO of Preferred Pain Center here in Phoenix and Scottsdale, Arizona. Today I'm coming to you from one of the Phoenix points of pride called the Tovrea Castle. Other people in Phoenix call it the Wedding Cake Castle because if you look at it from a distance like we are, it kind of looks like a three-tiered wedding cake. So it's very prominent and visible in the city off of the Loop 202, which goes east to west in the southern part of the city. And so people get to view it every day. It's really pretty. The grounds around the castle used to be, years and years ago, a lush desert botanical garden, and it will come back to that. Phoenix is renovating the property sort of slowly. It looks so much better than it used to. It's very attractive. It was built back in 1928 by an Italian immigrant named Alessio Carrero. Alessio finished the property. He had 277 acres around this area, but he became unhappy with some of the adjoining properties that started to have cattle and sheep, livestock pens, and he felt that the neighborhood was going to pot or whatnot. So he sold to the Tovrea family, who just happened to own one of the meat packing facilities in the area that were getting a lot of the livestock from the local neighbors. And they owned it up until the 1990s. Mrs. Tovrea passed away in 1969. Her estate took it over, and in the 1990s the city bought it and has been slowly renovating it, and it should be open to the public hopefully in the next year or so. At any rate, the topic for today that I wanted to discuss is facet injections for low back and neck pain. I did a video on this a year ago. It's gotten well over 1,000 hits at this point, so I wanted to do a new one and just freshen up some of that topic. Facet injections are one of the most common injections that pain doctors in this country perform, including our pain doctor, who is a board-certified, fellowship-trained pain doctor. The injections work well for axial pain, meaning pain that is in the neck or in the low back. It's not really meant for radiating pain down the arms or the legs. That's more where epidural injections fall into. Now, a patient can have pain that emanates from pain in the neck or the back and radiates a little bit out into the shoulders or maybe down into the buttock area. That's called radiating pain, and it can be from arthritis in the joints. The facet joints are tiny. They're little thumbnail-sized joints on either side of the spine, bilateral and symmetric, and they go all the way down at every level of the spine. As time goes on, just like any joint that has cartilage in it, they can become arthritic or damaged from a car accident or repetitive trauma on a daily basis, either from something as harsh as, say, football on a repetitive basis, or playing basketball on a repetitive basis, or a line of work that is a repetitive, tough motion, like a jackhammer operator or a truck driver or something along those lines. Genetics plays a part in it as well, we know, for arthritis. So, essentially, what are the treatments for neck pain that isn't going away? Well, doing surgery for neck pain in and of itself is by and large not a good idea, unless you have instability or a structural deformity. That may help, but by and large, most patients with neck pain, it's coming from the facet joints. So an injection into those facet joints with steroid or whatever the substance is, I mean, we're doing a study at Preferred Pain Center looking at other substances, but it can be extremely helpful. It can help you avoid surgery, get back and play with your kids, enjoy your social life more, less days off from work, things like that. So facet blocks, or injections as they're called, can be very helpful. The low back pain, they work well too. Usually if you have arthritis in one facet joint, you're going to have it in multiple. So are you going to have surgery and have those levels fused? Yeah, it may take away the pain, but if you fuse multiple levels where the arthritis is, you may end up with arthritis above or below those levels. You might need more surgery. That's a very commonly seen thing when you do surgery at 1 or 2 levels and the stresses go up or down and you need more surgery. Wouldn't it be better just to have an outpatient procedure, a facet injection that you could repeat 1, 2, 3 times a year and not have to worry about the risks of surgery? Yes, it would. So, facet blocks entail an outpatient procedure that could be done under IV sedation. You don't have to have that. You can have just numbing medicine under the skin. and then have your injection done. They can be done at multiple levels on the same day, depending on where the arthritis is. The pain doctor would make that ascertain that. If that works and wears off, the pain doctor can do what's called a radiofrequency ablation procedure that deadens the tiny little nerve endings that supply the facet joints, and that can deaden pain and get rid of pain for upwards of 2 years. Studies show that it can be 270 days, which is, what is that, 3/4 of a year? No, yeah, it's about 3/4 of a year. Up to 400 days, which, 400 and some days, which is a year and a half. All right, we've seen patients that get 2 years worth of relief. So it's variable, but very effective. Anyway, to read more, please go to our website at preferredpaincenter.com. You can also check us out on our blog, preferredpaincenter.com/blog. And give us a call today. We'd love to see you, 602-507-6550.